Yeah. And we are live. I would request all our panelists to come back on video mode. So just to thank Dr. Ucheria, uh, Rotarian Benjamin, all the clubs of Nigeria who have partnered in this project, which is Obesity Awareness Campaign. Dr. Ucheria, we would just like you to mention the names of the clubs. We won't go into much of details because we are already around 30 minutes behind time, but the Facebook link is on. Sending you, Vidhi. The Facebook link has to be sent group. And Dr. Ucheria, if you could probably take, you could just link to all the probable attendees. We forward that to the Rotarians and to the community.
That is loading. So
yeah, they were all affected by the Facebook
technical
streaming.
glitch.
Yes,
but now it has started.
Yes, they now. I went to they were holding meeting on the WhatsApp group, and there was confusion there. So just addressed it. They will soon connect.
You know that place
so now everyone can watch the FB.
Moto to Abuja campus.
Yeah, I think so. It is live now. So that is a good sign. Directly we can go ahead. We can mute all other videos, and we can have one session about the Rotarians later on. Please share this link to all the people on the group. Please share it to everyone in Nigeria so that everyone can take the benefit of it. And Vidhi, I would like you to restart with your part of panel discussion. We would like now this session to be a short and crisp session because we have got only 40 minutes now because we wanted to end this by 9 o'clock. So we'll all try to put in our efforts, Dr. Adana, myself, Dr. Vinanti, and Sneha, to give a very short, crisp reply so that we make it as a very small and interesting session rather than a long and boring one. So Vidhi, all yours. Can you please go ahead?
Sure. So once again, hello everyone. My name is Vidhi and I am a clinical nutritionist at Bariatrics. I am the international coordinator for outreach programs in Nigeria and Kenya. In today's session, we are going to discuss one of the most growing concerns, that is obesity. The issue that has been grown to epidemic proportions, with over 4 million people dying each year as a result of being overweight or obese. The number of people with obesity is increasing every year, and there is a lack of awareness about obesity, leading to various associated physical, medical, and psychosocial problems such as low in productivity, low self-esteem, low self-confidence. Though physical disability and medical issues are very common, but one of the neglected issues is psychosocial issues, causing decreased confidence and low self-esteem. But the only solace is that when a patient manages to lose weight, these medical issues, we have taken up this initiative under the Rotary banner to bring up about awareness amongst the community and train and guide them into healthy living. I would ask all the panelists to proceed with the discussion.
Vidhi, you can start with your panel questions, please.
Yes. So there is a one common question that always pops up. Why does one become obese? Dr. Manish.
So friends, obesity is a huge medical problem. It has come in the form of an epidemic, and obesity is also called as mother of all diseases. When obesity comes in, brings with it so many other medical problems. So a big question, why does obesity happen? Obesity primarily happens when energy coming in the body are more than the calories spent. So you see, there are two things to be considered over here. One is calories coming in the body. That means what you eat. Calories spent means how you exercise and how you spend the energy. So when the energy intake results, of course, people say that genetic reasons are there, that it is because of the genes that a person can become obese, but it is actually the environmental factors like easily available low cost foods, shopping malls, automobiles, next door shopping malls. You have so many other things which does not allow us to work. And in the earlier times, the children used to be doing so much of physical work like playing on the fields, and now it is all mobiles and mobile games. So all these reasons combined ensure that you are not losing any energy, you are only gaining in the form of eating food. So this is one reason why people become obese.
Okay, that shows a very clear concept, sir. But is obesity a huge problem, or is it being blown out of proportion?
Obesity is definitely a huge problem. It's a huge medical problem. Obesity, as I earlier said, it is supposed to be called the mother of all diseases. Mother of all diseases means it can give rise to so many other medical problems. When obesity occurs, people can have diabetes, people can have blood pressure, people can have heart diseases, infertility, snoring, sleep apnea, knee pains, back pains, cancers. The list can just keep going on. And it is not that it is occasional or it is accidental. It is very common. 65 to 68% of diabetics are obese. Around 70% of heart disease patients are obese. 70% of hypertensive patients are obese. Around 80% of sleep apnea patients are obese. Obesity causes cancer in almost 17 times the population than the normal population. So taken lightly. It is not just about the physical aspect of it. It is much more. But obesity also causes some major other problems apart from physical and medical. Those are psychosocial problems. The person who gets affected by obesity usually decreases his own self-confidence get decreased. The person who has got obesity goes into a low self-esteem. There is so many times public shaming that is happening. Person does not want to come out of his or her shell, and the productivity goes down, the diseases go up, the economical impact on the person, on the state, on the country increases. So obesity, in short, causes so many problems that it can never be ignored. And I think so it should be taken up on a priority anywhere and everywhere in the world.
Okay. So that obesity also causes infertility. So let me then ask Anna, what according to you are the risks that are associated with obesity in women?
Thank you so much for the question. Standing on existing protocol, I wish to say hello to everyone. Obesity is been found to be a multifactorial disease and has huge impact on the female's physical appearance, plus her sexuality and ability to.
Can I just interrupt, Dr. Adana? Your introduction has not happened. I would first like you to be introduced. Vidhi, can you first take time for half a minute to introduce Dr. Adana? I'm so sorry I interrupted because that part has not gone on FB. So whenever you have asked a question to Adana and then Dr. Vidhi, please introduce them in short so that people should know whom they are listening to. Please.
Sure. So introducing about Dr. Adana, Rotarian Dr. Edwin Adana Vivin. She is the secretary of Rotary Club Uptown Owerri. She is an obstetrician and gynecologist in Nigeria. She is also a public health practitioner and a state coordinator of SOGON, that is Society of Obstetrician and Gynecologists in Nigeria, Imo State.
Thank you, Vidi, for
Yes,
that
Dr.
introduction. Thank you. Can I go back to your question immediately?
Yes, sure.
Thank you so much. As I was saying earlier, obesity has a huge impact on the female gender, not just about their physical appearance, but it also affects ability to maintain regular menses, affects ovulation, has huge impact on infertility. It has also been shown to affect one common disorder in gynecology, what we call polycystic ovarian syndrome. And what it means is that there is a disorder in the chemistry of ovulation, and that will warrant things like recurrent miscarriages. That means that the patient will take in, conceive, but will not be able to carry the baby beyond the starting period, probably beyond 13 weeks or 20 weeks. Then also there are issues concerning diabetes, which has been mentioned. That is also seen in the female patients in gynecology clinics. Also the issue of failed responses to artificial reproductive techniques. What do I mean here? What I mean basically is even when you want to intervene, treat infertility, the success rate amongst obese women is quite low. And we found out that obesity is actually increasing in the general population, more so amongst the females. It is seen more in females than males. So, and these conditions, especially particularly the ones that are related to depression and then low self-esteem, have much more impact in response to treatment when it comes to trying to treat recurrent miscarriages, trying to treat infertility. And that also leads to certain issues. Of course, when one is not getting positive outcomes, it affects her representation even in societal activities, even in her marriage and all the rest of it. So obesity has been found to have huge impact in gynecological patients. Thank you.
Okay. So, Dr. Adana, in that case, what is the impact of obesity on infertility or PCOS? Can you just explain in short to our viewers?
Okay, infertility is said to be inability of one to conceive after 1 year of unprotected intercourse. Then the PCOS, which I earlier mentioned, is a condition, a disorder that affects ordinary ability of a woman to ovulate properly. So how does obesity affect these two conditions, or lead to these two conditions, or worsen these two conditions? Firstly, we find out that the quantity of adipose tissues increase in these women. So once this quantity of adipose tissue is found to increase, it alters the certain hormones that are involved in the regulation of these ovulatory patterns. And as such, it could lead to an ovulation that is poor ovulatory mechanisms, and it can also cause diabetes. It can cause things that will affect even proliferation of cells, like in the uterine lining, the endometrial lining. It can lead to what we call endometrial hyperplasia. It can lead to disordered growth of the lining of the uterus, which will later cause cancer in future. So now, also, when it comes to infertility, ability of the formed embryo to attach to the uterus is also challenging. That is what we call implantation. So there is high implantation failure. All these are said to be found before pregnancy. Now, when it comes to pregnancy, now assuming a few of them take in, conceive, obesity also has huge impact on pregnancy. Most times, some of them have what we call diabetes in pregnancy. There are issues concerning hypertension in pregnancy. There are issues with difficult labor, difficult deliveries. So we usually say, we usually prefer a woman to have optimal weight prior to conception. And of course, in this era, in this our region, where we focus more on undernutrition. We focus more on undernutrition. Obesity is grossly underreported or even managed. Nobody talks about obesity, especially in this part of the world, and it has become a huge challenge. So now when you visit the gynecology clinics, the proportion of infertile women is actually increasing. And also the proportion of obese women that are infertile is actually also increasing. Like now we have in our outpatient clinics, we have about 30 to 35% of women who are obese that present to our infertility clinics. So we can't continue to recount how obesity affects even the intervention, what we do for them. So it is still optimal. It is a topic that should be discussed. It has become a public health importance to address obesity, especially when it comes to gynecological practice. Thank you.
That wasn't quite an in detail explanation, Dr. Adana. It was also mentioned by Dr. Manish that obesity also has a huge impact on diabetes, which is also one of the most common issues today. So before moving towards Dr. Vinanti, I would like to introduce Dr. Vinanti. Dr. Vinanti Paul, she is a senior diabetologist, endocrinologist, and obesity consultant at Asta Healthcare and is the chief diabetologist at Sugar Care Mumbai. She is the deputy medical director at Acme Hospital, Chembur, recipient of COVID Warrior Award in 2021, and recipient of the Rising India Women Achievers Award in March 2023. Dr. Vinanti, I would like to ask, how does obesity increase the risk of developing diabetes?
Yeah, thank you, Vidhi, for the lovely introduction, and good evening to all of you. So my topic here will be regarding diabetes, which is a metabolic issue. So obesity, I would say it is not only a cosmetic issue, it has turned into a metabolic issue now. So what happens is, to give you a brief, in the insulin in the body secreted by the pancreas, the beta cells of the pancreas. So this insulin, it facilitates the entry of the glucose into the cells, into the tissues, into the organs. So I would like to mention here that alone brain, it consumes around 6 grams of glucose per hour. So every organ, every tissue, every cell needs sugar, needs carbohydrates for its proper functioning, and this is facilitated by insulin. So here, if insulin is not working well, so what will happen? So I would like to discuss this. So here what happens is, when the insulin, so here I would like to say is, insulin combats with the sugar levels in the body, and it prevents the surge of carbohydrates, the rising carbohydrates in the body. But what happens is, when the patient is obese, particularly when there is central obesity, which is also known as abdominal obesity, or you can say apple-shaped obesity, which is around the abdomen. So the adipose tissue, it accumulates around the abdomen. So that results in the insulin resistance. So this insulin, it becomes inactive. So as Dr. Manish sir mentioned earlier, so it is all about the balance between the calorie intake and the calories that we burn. And when there is an imbalance between the two, then there is a rise in the insulin resistance. And when the insulin is resistant, there is no facilitation or no entry of the glucose in the tissues and the organs, and hence the carbohydrates, the sugars, they remain stagnant in the blood, and this stagnancy, it gives rise to hyperglycemia. So eventually, which can lead to diabetes. So we can also say that insulin resistance is a precursor to diabetes, to pre-diabetes, which eventually it can lead to diabetes.
That
So
was excellent. That was an excellent explanation, Dr. Vidhi. What we have also heard at various places in various seminars, to put it in a very simple manner, is obesity. All human beings are multicellular, and happen in simple levels. And obesity, basically, what does it cause? It causes decrease in the production of the body insulin and decrease in the functioning of the insulin. So every body produces insulin. Dr. Vidhi, please correct me if I'm wrong. Uh, it is we've heard that every body produces insulin. So when we eat food, uh, sugars come in, the sugar levels can rise. But to control that sugar, our pancreas secrete insulin, and that insulin goes and tames or makes normalizes that query rising sugar. So what happens in obesity is, one, it causes decreased production of insulin, and second, whatever insulin is produced, it is not as effective as it would be in a non-obese person. This is this also the explanation, Dr. Vinanti? Because we've heard it in various conferences. Because we are not a diabetologist, but as a layman, I feel this is what we have heard. So is this
yes,
also the right way to present it?
yes, sir, you are absolutely right. So there
Thank
should be, as I said, that insulin resistance is always directly proportional to obesity, or it can be either way. Obesity
Okay.
can be directly proportional to insulin resistance. So higher the obesity, greater is the insulin resistance.
Oh, thank you so
So
much.
of course, there should be some, so we have to make some lifestyle changes to prevent this obesity and to make, to avoid insulin resistance.
Okay. Thank you. Thank you. I was just reconfirming because this was what we have been hearing. Yeah, Vidhi, I'm so sorry to interrupt you. Vidhi, you can please go ahead.
So my next question to you, Dr. Vinanti, is what type of diabetes is most common in obese patients and why?
The most common type of diabetes is type 2 diabetes, also known as non-insulin dependent diabetes. And this is because, see, in type 1, there is absolutely congenitally no insulin or very minimal insulin. So there is no question of insulin resistance, as there is no insulin at all. And very minimal insulin is present in type 1, which eventually diminishes with over a period of time. So the patient has to remain dependent on external insulin throughout his life. So in type 2, what happens is there is normal secretion of insulin. The insulin is secreted from time to time normally. The only difference is it is resistant, it is inactive, it is not showing its action, and it is not acting on the carbohydrates. So the most common diabetes that occurs is type 2 diabetes.
Understand. Moving ahead, Dr. Manish, you come in here with lots of experience. So kindly help us to understand how do you treat obesity?
Sure. Vidhi, with your permission, can I share a slide?
Sure, sir.
So friends, let me just come on to this. We'll just introduce our So friends, we come from Astha Bariatrics, which is a center of excellence in metabolic and bariatric surgery. And I'm personally the district governor nominee for 25-26 for Rotary District 3141. Our center is a center of excellence, means there are only 2 centers of excellence in Mumbai and 10 in the country who are doing extraordinary work in the field of obesity and obesity care. Friends, obesity is a medical problem, and every medical problem requires a scientific solution. And scientific solution is very important because when we have a scientific solution, we can guarantee results. Now, how do you give any disease a scientific solution? You give a disease a scientific solution. For that, first you need to understand what is the level of the disease, stage of the disease, what is the severity of the disease. Once we have understood the severity of the disease, then it is very easy to treat the medical problem. Today there is a big problem that is coming up, that every second person that we come across is a doctor for diabetes. See, we are facing a medical problem which has got multiple causes, multiple side effects, and multiple treatment options. But every second person we meet, whether it is our friend, our relative, our servant, our gardener, our liftman, whenever they see you as obese, every second person wants to come and give you an advice. And people get confused that what is the best treatment, what is the right treatment for obesity. Friends, right treatment can come only when you gauge level of severity, and that happens on the basis of BMI, that is body mass index. What is body mass index? It is a calculation of what is your weight with regards to your height. Now, as your BMI increases, the medical problems increase. So if you see here, there is a patient who would have been less than 25 BMI, which is supposed to be normal weight. The chances of having diabetes is 4%. But if the patient has a BMI of more than 40, that is morbid obesity, the chance of having diabetes is 26%, 6 times rise. Take high blood pressure. If the patient has, for a normal population, less than 25 BMI, the chances of having diabetes, high blood pressure is 16%. Once the BMI is more than 40, that is high BMI, the chance of having high blood pressure is 51%, 3 times rise. So friends, as the obesity increases, the health risk increase. As the obesity increases, the problems and complications increase. And anyone who is less than 25 BMI is supposed to be normal weight, 25 to 29.9 BMI is overweight, 30 to 34.9 BMI is grade 1 obese, 35 to 39.9 BMI is grade 2 obese, and more than 40 BMI is grade 3 obese. Friends, majority of the patients who come to us are usually less than 30 BMI. That means there are so many patients who can be prevented from going into the level of obesity, because once obese level comes in, the treatment becomes very limited. But when you are in the normal and overweight category, you've got so many treatment options. Treatment options can be diet, lifestyle modification, medications, exercise, multiple other things. So I will just like to tell you all the treatment option as per every category. Friends, listen to this very, very carefully. When a patient is normal weight, we give the patient diet to maintain the weight or reduce the weight by 3 to 5 kgs. The capacity of diet is to reduce 3 to 5 kgs, but in a patient who is 3 to 5 kg overweight. So if you are 3 to 5 kg overweight and I give you diet, you reduce that 3 to 5 kg and you maintain that lost weight also. But even if you are 10 kgs overweight, then probably diet is not the line of treatment. For once, if you put in all your efforts and reduce that 10 kgs, if you lost 10 kgs, you will gain back 12 kgs, because for 10 kgs, you go into the overweight category, patients have to do diet plus something extra in the form of gym, yoga, exercise, liposuction, tummy tucks, various other methods. But if you're say 7 to 10, 12 or 14 kgs overweight and you do diet and extras, you will lose that weight and you'll be able to maintain it also. But once you go into obese categories, the option becomes bariatric surgery. But you know that bariatric surgery is for a very small category of patients. The major category of the patients are the ones who are less than 30 BMI. And if you're less than 30 BMI, why not put in your best? Why not put in those efforts? Why not control your diet? Why not put in that extra exercise to ensure that you lose weight, and you lose weight scientifically in a systematic manner? So friends, one thing is very clear, that if you do some ideal eating methods, you can always gain better health. Ideal eating is no fasting, no feasting. Ideal eating means snacking between meals. Ideal eating means having all the constituents of food in every meal. Ideal eating means taking good time to eat every meal, not to hurry up and causing indigestion. Ideal eating, friends, also mean to avoid the 3 bad whites, which is sugar, salt, and maida, what we call. Ideal eating also means that we are supposed to have good quantity of water every day. And ideal living means if you can add some amount of exercise to it, you have really won the battle. Of course, Sneha, our chief nutritionist, is going to give you more details about it. But patients who are less than 30 BMI, who form the majority bulk, can be treated with diet, exercise, lifestyle modification, medicines, injections, some diet therapies. There's so many options in front of us. Once the BMI goes more than 30 and you go into obese category, friends, then the only option remains is bariatric surgery. And what we want to do is to help you all to prevent obesity rather than obesity coming in, complications coming in, and then you go on to treat it. Vidhi, I hope I have been able to do justice to the question that you have asked. Uh, so it all happens, as I said, obesity medical problem. Every medical problem requires scientific solution. Scientific solution is based on severity. Severity is on the basis of BMI. Anyone who is less than 30 BMI, treatment is all conservative methods, and more than 30 BMI, that means you go into obesity, you might require bariatric surgery. Is that fine, Vidhi?
Yes, sir. That was quite insightful. We move ahead to Dr. Vinanti. Dr. Vinanti, have you seen a good response in obese diabetics with weight loss?
Yes, of course. As there is a weight, the patient starts losing weight through proper diet, through proper exercise, through medications. As the patient starts losing weight, we have seen that the insulin, which was resistant earlier, starts becoming sensitive. And hence, this is the time when the patient, the sugar levels start coming under control. The requirement for the medications are minimized. The insulin, if the patient is taking insulin externally, the dose is reduced, or maybe it can be waived off over a period of time. But now here we can categorize into a BMI with diabetes. The patient, as Dr. Manish sir already mentioned, that if there is a patient with BMI up to 30, and if he's a diabetic, then of course we can advise the patient to adopt a healthy lifestyle. It is not about eating less, but it is about eating right, and to add some kind of physical activity so that which promotes weight loss, and hence it allows the insulin to become more sensitive. But when the BMI is above 30, now there are various things, various hindrances which doesn't allow weight loss. For example, the knee joints, the ankle joints, which are weight bearing areas. So if you ask such an obese patient to walk for almost say 30 to 40 minutes a day, the patient will feel exhausted. The joints will start paining, and ultimately the patient is going to quit. So at this point of time, only diet is not going to help. You have to come out of your comfort zone. You have to do some extra activities. But because this overweight is putting a hindrance somewhere to lose weight, so over a period of time, at a point, the weight gets stuck. And this is a time when the patient should opt for bariatric surgery, which is a permanent one, and it is also a key to weight loss. And once the patient starts losing weight, the insulin starts becoming sensitive, and automatically the control over the sugars becomes more better. The diabetes slowly, gradually, eventually it comes under control with minimum required for the medications. And likewise, the patient can adopt for a healthy lifestyle.
We absolutely agree, Dr. Vinanti. My next question to Dr. Adana would be, Dr. Adana, you would be coming across various obese, infertile, and obese unmarried. So does weight loss impact their disease status too?
Yes, it does.
And what would be the ideal patient treatment pathway for an obese, infertile, or an obese unmarried?
Okay, it depends on the BMI, which has been earlier discussed. For the ones that are overweight, which means they have a BMI of less than 30 kilograms per meter squared. For those ones, we do a combination of factors: nutrition, exercise regimen, diet, then control of comorbid factors, and use of some ovulation induction agents. However, if your BMI is more than 30, that means if you're obese, we'd rather go to medical treatments with emphasis on bariatric surgeries. Why? Because we appreciate every percentage loss in weight, especially when you have at least more than 10% weight loss in obesity. It helps to improve your fertility chances. as well as improve successes of treatments for infertility.
Understood. So, well noted as a consensus statement, obesity is a huge medical problem, and WHO has pronounced obesity as the #1 killer. It causes various physical, medical, and psychosocial issues. But if the right treatment is given to the patient at the right stage, at the right time, not only does weight loss happen, but along with weight loss, the medical problems also resolve. So patients with a BMI of less than 30, along with medical issues, for them, diet, exercise, and lifestyle modifications plays a vital role. But for patients with a BMI greater than 30, irrespective of their age, gender, or marital status, let's now move on to our clinical nutritionist, Ms. Neha Salyan. Before moving, I would like to introduce Ms. Neha. So she is a registered dietitian and a certified diabetes educator. She is an experienced consultant with over 10 years of experience and is currently the chief bariatric nutritionist with Astha Bariatrics. So, Ms. Neha, my next question to you is, here we have a patient with less than 30 BMI. So how can we achieve a good weight loss?
So, as Dr. Manish mentioned, for somebody who is less than 30 BMI, there are various methods to help lose weight and attain a healthy body weight. So, to start with the basics, the first and foremost thing is diet. Having a healthy, balanced meal is something which is very, very important. Balanced meal means a combination of your carbohydrates, that is your cereals, your proteins, your vegetables, that is your fibers, having it in the right portion, wherein half your meal is filled with your fiber, which gives you your vitamins, your minerals, and roughage, half of the plate, the remaining half again with cereals and proteins. So cereals are your energy givers, proteins are the basics for your muscles. So having a right balanced meal, including all the macros, is very, very important. A good portion control is the key. Now, one of the most important thing that I tell all my patients is eat till you are 70 to 80% full. The reason is because when you leave that 20 to 30% of space in your during your meals, you end up feeling hungry again after 2.5 hours or 3 hours. And that's how you are able to follow a pattern, that is small and frequent meals, which most of you must have heard from almost every nutritionist. So small and frequent meals, meal pattern is the best way to go about, so that your energy balance is maintained very, very well. Another important thing is right kind of snacking options, choosing the right kind of snacks in between your meals, in between your main meals. And the snacking option should be healthy options like your fruits, yogurt, nuts, seeds, milk, eggs, and more of proteins basically. Apart from diet, what is again very, very important is your exercise. Because exercise not only helps you to lose the excess energy that you've taken in from your diet, but also important for a healthy mind, healthy body, and helps to improve your overall health. As Dr. Manish said, we should keep away from the 3 Ws, that is your 3 Ys, basically the sugar, salt, and refined flour, because all 3 of them are very, very unhealthy for us. Hydration is the next important thing, which is very, very important, because hydration, our body is around 70-75% fluid, and if we are not hydrated, we are going to have multiple medical issues. We are not going to be able to lose fat well. We're not going to be able to do our day-to-day activities because we are dehydrated. So hydration is very necessary. And it is also helpful because we will not feel hungry very frequently if we are well hydrated. And as Sir also mentioned, there are other therapies also. So there comes a point where diet stops working. As Dr. Vinanti mentioned, at certain point of time, the diet does not work and your body gets stuck at a particular weight. So that is particularly, that happens when you are somewhere between 25 to 30 BMI, wherein you are not able to lose weight just with diet. And that's when you need additional help with the help of exercise, yoga, certain medicines, certain therapies like liposuction or lipo, and there are many other treatment options available. So basically, to summarize, diet, exercise, hydration, and choosing the right options and choosing the right treatment for your weight is very, very important.
Sneha, very well said. But Vidhi, if you would allow me to interrupt for a second, friends, we hear from a lot of people, and you would have gone to a lot of nutritionists where they keep telling you to have multiple small meals, multiple small meals. There is a reason and purpose why you're supposed to have multiple small meals. As I said, nowadays, a physical exercise is very scarce, and there is lots to eat. So when you have three big meals, you're not increasing the metabolism also so much. But when you have got multiple small meals, what is happening is you are also making your intestines run every 2 hours to do digestion. So they say that if you cannot run, let your intestines run. Again, a very simple method of letting everyone know. If you cannot run, that is, you cannot do physical work, at least eat something very small quantities every 2 to 3 hourly, and make your intestines run, because they will have to run to do digestion. And that also increases your metabolism, that also increases your chances of losing weight. So as we've just seen, have multiple small meals, small bites, chew well, don't have water with meals, don't have too oily, too spicy food, don't have too sugary meals. If you can maintain these small things, you will always lead a very good life. So you're not supposed to do lots of fasting, lots of feasting. Anything and everything in moderation. Are bound to maintain weight, you are bound to lose weight, provided your BMI is less than. I was just trying to put in our experience of last 2.5 decades in very simple words, not as specific as you said, but just for a common man to understand.
Yeah, thank you so much, Dr. Manish. My next question to Ms. Neha would be, a lot of people today, they go to the store and they read the food labels effectively and make informed choices for managing their weight.
So actually, that's very interesting question, because majority people do not know how to read food labels. And I do get a lot of patients telling me, oh, this is just 200 calories. This is not even 10% of my throughout the day's calories. So I am okay to consume this. So how do we exactly read labels? Now, whenever you look at the nutrition label, first thing that we should be looking at is the servings. How many servings does the container contain? What is one serving? So if one serving is 30 grams, then 30 grams, you have to check the value of each of the nutrients for 30 grams. So now, in the nutrition label, we should be looking for calories, we should be looking for proteins, we should be looking for fat, basically our macros. We should be definitely concerned about how much added sugar is present in the food that we are buying, and definitely the amount of sodium, because most packaged foods are very, very high in sodium. Now, how do we exactly know if whatever the amount is correct or not? Just next to these macros, there are units mentioned, as in, for example, calories, 200 calories, proteins, 6 grams. Next to that column, there is also another column called percentage daily value. This percentage daily value basically helps us to understand how much percentage of calories or proteins or fat is present in this one serving of the food that we are buying. And that percentage daily value should always be more than 5 and less than 20. Basically, the percentage daily value of each nutrient should be between 5 to 20. If it is less than 5, that means it is not giving us enough nutrients. It could be calories, it could be proteins, it could be fat, it could be carbohydrates. Similarly, if it is higher than 20, that means it is giving us excess which our body is not requiring. Then in that case, to balance out our calories, we have to manage the rest of the meal, which practically doesn't work that way. So whenever you're looking at food labels, as I said, percentage daily value between 5 to 20 is very, very important. Zero added sugars, because sugars are something that are usually hidden. And apart from that, sodium, again, very, very important, because most packaged foods are going to have sodium. But to summarize, I would say try and avoid packaged foods as much as possible. It's always better to go to fresh foods as much as possible. Thank you.
Understood. My next question to you is, in what ways can we curb hunger and prevent overeating?
So in order to curb hunger, as Dr. Manish explained, having small frequent meals, because you are going to be burning that much calories every frequent, you are basically running your intestine. So by that, you're going to actually end up, not utilizing too much calories. So what you should ideally be doing is having your meals after every 2 to 3 hours. So instead of a 3-meal pattern or a 4-meal pattern, our meal should be 6 to 8 meals pattern, wherein we are having small portion at a time, very rich in fiber and protein, because that takes a longer duration to, go, or maybe the transit time is higher. So foods rich in protein are your meat, your dairy, your lentils, your pulses, basically, which take good enough time to be digested, but at the same time, very, very healthy. Your vegetables, your salads, your fruits, these are again very good options, which you should be consuming frequently. As I mentioned before, also choosing healthy snack options is also very important. Now, another way of curbing, hunger is hydrating yourself well. So most of the time, when we feel hungry, the best way to, manage that is first having 2 glasses of water. Because when you have 2 glasses of water, 90% of the time our hunger is gone, because we were not actually hungry, we were just thirsty. So try doing that next time. But if you still feel hungry after 15 minutes, then that means you are actually hungry. So most people do not drink enough water throughout the day, and they keep on munching foods because they feel they're hungry, but it's not hunger, it's dehydration. So hydrating well will ensure curbing hunger. And one more way to take care of hunger pangs is choosing, as I mentioned about the proteins and fibers, choosing healthy options. Because if you keep snacking on chips and any other junk foods, you're going to crave for those more and more and more. And this is going to be a never-ending cycle, basically.
Got it. Thank you so much, Ms. Neha. Okay, so friends, the concepts have become more clearer now. These inputs have been now valuable. Coming to Dr. Manish, you clearly said that anyone who has a BMI more than 30 will need bariatric surgery. Can you throw some light on what is bariatric surgery and what are any risks that are involved?
So, Vidhi, I think so. The webinar is going quite good, and Sneha, Dr. Vinanti, and Dr. Adara, you all have done a phenomenal work where people have now understood. So the main concept of this event today was to sensitize the people that obesity is a medical problem. It is not just a sign of healthy living. Obesity is a huge medical problem, and obesity is a medical problem which requires a scientific solution. And if we treat obesity at the grassroots, at the initial stages, at the bud stages, we can prevent it going into higher stages. We can prevent it from going more than 30 BMI. I'm also happy about one thing, that whether it is a diabetologist who's practicing, a senior diabetologist in Mumbai, or a senior gynecologist in Nigeria, or a nutritionist from Mumbai, or myself as a bariatric surgeon, we all are on the same page that obesity is a medical problem. Medical problem needs a scientific solution. Scientific solution is based on BMI. Any patient with a BMI of less than 30, which are majority of people, can do very well with diet, exercise, medications, injections, and various other modalities. But once the BMI goes more than 30, friends, then the treatment option remains only one, and that is where we cause major weight loss. So these are surgeries which are done on the stomach and intestines. These are done laparoscopically. These are done with the help of 4 or 5 small holes. You don't you don't make major cuts. It's only through 4 or 5 small holes. Friends, we'll be going very much of brief here, because this is not the main part. The main part is how we can prevent obesity. But there are various types of bariatric surgeries. It can malabsorptive, where we do bypasses, and mini gastric bypass. We do these surgeries, robotic. So earlier there was a time when this surgery used to be done with the help of big cuts from up to down. But now these surgeries are done either with 3 or 4 small holes, or sometimes a single hole, which is also called a single incision laparoscopic surgery. One of the commonest procedures is a sleeve gastrectomy. How? We will just tell you, where the stomach is converted into stomach is removed. This has been a life-changing surgery, which is mini gastric bypass, where it's a very strong surgery. This is also known as surgery for diabetes. We have thousands of patients who are uncontrolled diabetics on insulin, having more than 150 units of insulin, and still having more than 300 sugar levels. Now 99% of them would not be even taking a single medicine. But friends, we don't reduce their medicine. We always involve the diabetologist, the physician, to ensure that this happens in a scientific manner. There is gastric bypass, which is also considered the gold standard, which causes good weight loss as well as a decrease in diabetes. This is also one in which, if a patient is having bad sleep apnea, that snores a lot, patient has got bad acidity along with obesity, with this surgery, not only does the weight go down, but all those problems are even sorted out. And this is a small presentation of sleeve gastrectomy, where the patient small holes, friends. And in this surgery, I'll just show you a small video if you are keen on, where this surgery is performed laparoscopically with the help of a few small holes. We don't make any major cuts. Only small holes ensure that the entire procedure is carried out scientifically without any issues. So this surgery is done laparoscopically. I believe small holes. From these small holes, my laparoscopic trocars go inside. From these trocars, long and thin instruments go in. From one of the holes, my telescope goes in. Telescope is attached to camera or TV. We look into the TV and operate. As the telescope goes in, we see the stomach, the organ of concern. Smallest of small thing looks 10 times magnified, so precision of surgery is very high. As per the size of the patient, what should be his weight? As per the weight, what should be the amount of food going in, vitamins going in, proteins going in, hormones released, how slowly the weight loss should happen. Everything is calculated minutely, millimeter to millimeter. And then the stomach is divided into 2 parts. Left is that part of the stomach which was originally the patient's, that is retained. The right side is the one which was excess, that is removed from the same small hole. Once that part comes out, this becomes your stomach, which will give you all that amount of food that is necessary to take care of energy needs, your hunger, so that you are never at loss of energy. You're always working at 10 times your potential. Friends, this surgery is called a sleeve gastrectomy, which is one of the commonest. But yes, one thing is very clear. Anyone who is less than 30 BMI, treatment option is no surgery. More than 30 BMI, we advise surgery. But once you are more than 32 BMI, the treatment option becomes only surgery. So let's work hard to not allow people to go more than 30 BMI. Let's work hard that we retain them in the normal or overweight group. Let's work hard to ensure that medical problems don't come into them. If all that happens, friends, we will be able to treat patients well. Your life will become better. Your productivity will become better. Your efficiency will become better. Your disease will not come into your body, and you will be a healthy new generation. So let's do this, because once your BMI goes more than 30, then bariatric surgery is the only option. And without that, there is no other treatment which can help you. I hope, Vidhi, I've been able to answer your query.
Yes, sir. That was quite helpful. Moving ahead, Dr. Vinanti, can you tell us how bariatric surgery impacts the blood sugar levels in patients with diabetes? And can a patient also go off medications post-surgery?
Yeah, that's a very good question. Actually, I have been seen, and I myself, I'm a witness of this thing. That yes, bariatric surgery, once the person starts losing weight, the insulin automatically starts becoming sensitive. Even if you lose around 2 to 3 inches along your waistline, that will give you a drastic difference in your insulin sensitivity. So with a bariatric surgery, the person starts losing weight. The person who was initially taking insulin, say 2 times, thrice, or 4 times in a day, which he was just pissed off with that, and it was a very troublesome situation for that person. I have seen that the patient is completely waived off insulin. So insulin is no longer required after bariatric surgery, after the weight loss, as the body insulin itself has become sensitive to the carbohydrates. And in some cases, those who are taking multiple medications, the medications are reduced to a minimum, and only a low dose has to be maintained as a maintenance dose. Those who are already taking just say 1 or 2 medicines, they have been also waived off medicine in some cases. But yes, it does help a patient a lot. The best part of this is the patient is completely insulin free, so there are no more prickings, and there are many hassles regarding the insulin, and like the patient has to, when the patient has to go out of town, carry all the insulin stuff and all. So no more hassles, no more pricks, and the patient is really gets a quality life with post surgery.
Got it. Thank you so much, Dr. Vinanti.
Thank you.
Dr. Adana, my next question to you is, can weight loss surgery help in treating infertility?
Yes, weight surgeries can help in treating infertility. As I earlier mentioned, once there is reduction in weight, either through the medical treatment or the use of bariatric surgeries, there is significant alteration in the reproductive hormones that promotes ovulation, regulates menses, improves implantation of the fetuses, and prevents miscarriages. Not just that, even there are increased chances of obtaining better outcomes when you intervene in cases of artificial reproductive techniques, in cases of in vitro fertilization, and the other technologies. There is also improved pregnancy rates when you take ovulation induction drugs. There has been recorded successes in better pregnancy outcomes, especially following obvious reduction in weight. I know that it may be challenging, though post-operative care and optimal management improves outcome in pregnancy after bariatric surgeries. Thank you.
Got it. Thank you so much, Dr. Adana. Coming back to Ms. Neha, I would like to ask, what are the dietary changes that are required post-bariatric surgery?
Post bariatric surgery, usually it is going to be just treatment. In the initial 6 to 8 weeks, we look at treatment, or we look at healing the stomach or healing the body. So initially we put patients on, we start with liquids, we start with clear liquids, we move to residual liquids for up to 2 to 3 weeks, and then we move to semi-solid foods, just like a newborn baby, how we transition them from liquids to regular foods. Similarly, over here also we take around 6 to 8 weeks to transition from liquids, then to semi-solid, and then to soft diet. And once the stomach is strong enough to consume foods very nicely and hold food nicely, then we start with regular foods. But then yes, there are certain basic changes that, or basic guidelines that we teach or counsel all our patients to follow. These basic guidelines are something that each one of us should be following for a healthy body, and nothing very difficult to follow, honestly speaking. Having small meals, as I mentioned earlier, also having small meals, having frequent meals, chewing your foods very, very well, choosing healthy foods when you're going out, choosing the right kind of food from a if you're going out to a restaurant or going out to any function, choosing the right kind of food over there, uh, eating food in the balanced pattern, taking good amount of nutrients from all the macros and micros, basically. So these are the small things that you should be focusing on. Not having fluids half an hour before and half an hour after meal, so that you're not ending up stuffing yourself too much, not eating too spicy or not eating too oily foods. Cheat meals should be not very, very frequent, but yes, definitely you can enjoy all kind of foods. So a few basic guidelines are being counseled, and dietary changes, as I mentioned, it is just the initial 6 to 8 weeks, which is a transition phase. Post that, it's all about habits and the relationship that you build with your food. I hope that answers the question, Vicky.
That was an in detail explanation. Thank you so much. We again come to Dr. Manish. I would like to ask, what is the success rate of bariatric surgery for patients who are obese and diabetic or who face fertility issues?
Friends, this is a very pertinent question. So, as spoken by our respected gynecologist, Dr. Adana, obesity and hand in hand, obesity and hormonal problems go hand in hand. So, I would again like to speak on the practical aspect of it. Friends, when one partner is obese, the chance of infertility is around 50%. When two partners are obese, the chance of infertility is around 75%. So, as a practical thought, we feel that before marriage, if the girl or boy lose weight, then but natural, if you're a normal weight patient, you will get a normal partner. So if the girl is normal and the boy is normal, the chances of pregnancy and pregnancy-related complications go down. But if by chance the girl is obese and she gets the boy also who's a obese partner as obese, then first of all, the chance of conception go down. And if the person conceives, there are high chances of miscarriage. If the miscarriage doesn't happen, then in the 8th month, there are high chances of miscarriage, pregnancy-induced hypertension, pregnancy-induced diabetes, and then pregnancy-related complications. There are so many things that can come up. So it is absolutely safe, 200% safe, to lose weight for obese, infertile, married, or unmarried with PCOS and hormonal problems, only for those who are more than 30 BMI, to undergo bariatric. Extremely good. You'll get some extraordinary results. We've had hundreds and hundreds and hundreds of patients who were obese and infertile and had also gone through IVFs which had failed. That is in vitro fertilization, that is artificial reproductive treatments. And they have just conceived by simple bariatric surgery. So yes, bariatric surgery is safe for unmarried girls, for married and who are not getting married and infertile with obesity, they get some phenomenal responses, Vidhi.
Thank you so much, Dr. Manish. I think that was really helpful. Uh, I would also like Dr. Manish to summarize the entire discussion that we had.
Sure, Vidhi, it will be my pleasure. So, friends, let me come back again to the basics. Friends, we have got together over here on this platform to discuss obesity and obesity's rising concerns. Problem. Obesity is called the mother of all diseases, causes diabetes, high blood pressure, heart diseases, cancers, sleep apneas, infertilities, and you say the medical any and every problem that you can name can happen because of obesity. So when you have got such a major medical problem, then let's treat it scientifically. Scientific treatment is on the basis of BMI. BMI is body mass index, that is what is your weight with regards to your height. As per BMI, anyone less than 30 BMI is normal weight, where you can prevent going into obese levels, and their diet, exercise, lifestyle modifications, physical training, injections, medicines, multiple things which can help you. And I feel we should put in our heart and soul to do that. We should start this from childhood onwards, where the child is given the best methods of eating and living and physical exercise. We need to have good amount of water every day. You should exercise for at least 45 minutes a day for 6 days a week for 365 days of the year. You have to eat sensibly. You have to eat in moderation. One golden mantra I would like to tell you: whatever you love to eat, have it for taste, and what you need for energy should be different. Because if you love to eat something and you eat it for energy, you're going to overdo. So anything and everything in moderation is always good. Do that. You can prevent obesity. Because friends, once you go into obese levels, then the treatment is only bariatric surgery. Come what may, you cannot get rid of or stay away from bariatric surgery. Of course, bariatric surgery is not a bad word. Bariatric surgery has been life-saving, life-transforming. It changes the life and quality of life of a person. It is changing the way you look at life and how people look at you. So bariatric surgery is excellent tool, but why not prevent obesity rather than going later on and treating obesity? But if you reach more than 30 BMI and bariatric surgery has to be done, friends, it is safe. Right from a 9-year-old to a 77-year-old, right for an unmarried girl or boy to a married person, right from patients who have got diabetes and high blood pressure and heart diseases to people who have got only heavy weight. It not only reduces your weight, it reduces the medical problems. More importantly, it helps the patient gain that extra confidence, that extra productivity, that extra energy to do something in life. So this is the way, friends, I would like to summarize. But I would also like to tell you all some more thing. I'm extremely thankful, grateful, and honored that our Rotary clubs in Nigeria, 12, 13 Rotary clubs have come together to do this event, which is the obesity awareness webinar. Friends, our first stage is where we are doing this webinar, where we are in Mumbai and you're in Nigeria. But the second step is going to be where we are going to come in the next 2 months to Nigeria with our team of people, where we are going to organize physical public awareness seminars. We are going to organize free checkup camps. We are going to help people prevent obesity and get rid of obesity. This is not it. Once this is done, the third round is going to be when in January or February, we are going to come with our team of doctors and train people to your country to train people over there in advanced obesity care, in prevention of obesity, and once obesity comes in, how to treat it. So this is going to be in a stage manner, friends. This is Dr. Manish Motwani, District Governor nominee for 25-26 for Rotary District 3141. And it has been my pleasure to associate with your Rotary clubs and your district to take this message of obesity awareness all throughout. We are sure with our joint efforts, we'll be able to get rid of obesity, prevent obesity, and ensure that our next generation becomes the healthy generation. So I feel I have summarized it well, Vidhi. Now the ball is again in your court. Anything else would you like to say or ask? Please let me know.
I would like to thank Dr. Manish first. There are a lot of questions from our viewers. So the first question is what, I think Dr. Manish, you can answer this. What is the cost of bariatric surgery?
Vidhi, is there some network issue? We couldn't hear what you said.
So I would, as we said that this is Astha Bariatrics is a center of excellence, and we keep getting patients from India to Astha Bariatrics specifically. So because Astha Bariatrics is a center of excellence, so anyone coming to the country will always search for a center of excellence. So I would like to show the experiences of a few people who have come down to India to get treated for obesity. I will just share my page.
Vidhi, while you are doing that, so friends, what we are also doing over here is for our Rotarians and community in Nigeria at large, anyone who wishes to uh, have more in-depth knowledge about this, anyone who wants to even participate in patient care over there can connect with us. We are there for the community. We are here to ensure that we can provide that every extra bit of effort. I think so on the Facebook page, my team will definitely put down our cell numbers where people can connect with us. And if at all the cell numbers and email IDs, if at all you all are very keen and you all wish to know something more about it, about how to take care of obesity, my team will be more than happy to guide you all, help you all, and ensure that we take this to the next level. Vidhi, what do you want to show? Is it something very important? Otherwise, I think we have already overshooted the time by almost 20 minutes. This was supposed to get over by 9. It's already 9:24. So we can even...
Just a moment.
Vidhi, we can't hear anything. Can you... Vidhi, I feel this is a day of technical glitches. We can avoid this. We would just ask, yeah, Vidhi, you can avoid it, please. And if there is anything else you would like to say, rest in the Facebook link and the Facebook, you can pass on the cell numbers of the team who can going out of the way to help each more than happy to help you and guide you too. Vidhi?
Yes, sir. I would like to thank Dr. Manish, Dr. Adana, Dr. Vinanti, and Ms. Neha for all the knowledge you all shared with us today. It was a very informative and helpful for most of the people who suffer from obesity, diabetes, and infertility issues, along with other comorbidities. I think the message to all is very clear. Obesity is a medical problem and has to be treated scientifically stage-wise. So to all the viewers watching us today, please give your comments on more topics that you would like to talk about in the future. Bariatrics. We would like to thank Dr. Yucheria and for our all-round initiative. And on behalf of Astha Bariatrics, we want to take this further to the next stage with everyone's support, involvement, and cooperation. Thank you so much.
Dr. Yucheria, now you would like to have the closing.
Okay. Thank you so much. The panel is very exhaustive. On behalf of the co-hosting clubs of this event, I want to appreciate the panelists for this exhaustive, informative, thought-provoking, exciting, and fulfilling lecture you have given us today. When I mentioned the names of the clubs earlier, they were not present, but now I know they are somewhere. They include, and I appreciate all of them for being part of this event: Rotary Club of Port Harcourt, Abloma, Rotary Club of Port Harcourt Seaport, Rotary Club of Port Harcourt East, Rotary Club of Port Harcourt New City, Rotary Club of Ugali Metropolis, Rotary Club of Port Harcourt Metropolitan, Rotary Club of Port Harcourt City Valley, Rotary Club of Port Harcourt Spring Gardens, Rotary Club of Port Harcourt Gulf Estate, Rotary Club of Port Harcourt Opobo Shoreline, Rotary Club of Oyibo, Rotary Club of Rumi Bekwe, Rotary Club of Sapele Urban, and Rotary Club of Alu New Dawn. We want to appreciate the guest speakers and everybody that connected despite the hitches and has stayed with us up till now. Because of network, I think, and with your permission, I hereby call this webinar a Rotary program to a close. Thank you.
Thank you so much, friends. It was a pleasure. We can now stop the Facebook Live. Vidhi, can you do that?
Yes, sir.
Dr. Yucheria, it was an absolute pleasure. Dr. Adana, Dr. Vinanti. We had some hiccups.